Okay, I just wanted to get on here to respond to this and say that is completely valid and that you are not alone in feeling that way. In fact, so many people feel that way when they're starting out therapy for depression because so much of it is focused on what we call behavioral activation or getting out and doing stuff. And I'll admit that when I was learning to become a psychologist and learning behavioral activation for depression, I had the same thought. I was like, okay, so you're just saying do stuff and you're supposed to get better? But what if you can't do stuff? It's hard, right? Because when you're depressed, there's a lot of hopelessness and negative thoughts, and that stops you from being able to do the things, not to mention fatigue and physical symptoms. And I will add there's also some truth to this. This is what we know is effective for treating depression. Now, is going outside a cure-all? And do I actually think that just going outside is going to cure depression? No. My last post was a little tongue-in-cheek and hyperbolic. And if I thought you could totally cure depression just by going outside, my job would be completely irrelevant. But what is true, what we know from cognitive behavioral therapy is that thoughts affect your behaviors, which affect your mood. So to improve your mood, you need to work on both your thoughts and your behaviors. Oftentimes, it's hard to start just changing your thoughts because we actually don't have that much control over our thoughts. What we can start with is behaviors. Is it easy to change behaviors? No. Just because it sounds simple doesn't mean it's easy. But it is more straightforward than changing thoughts. So if getting outside, during golden hour or whatever it is, feels too big when you're depressed, the key is to just start getting momentum going so that you can start moving in the right direction and just start to get some of that energy and get out of that depressed hole. So if that's too big, start with something really small. Start with, opening a window. Start with throwing away a piece of trash. Doing these little tiny things, starting off as big as you can. If that's the biggest thing you can do, great, do that and get the momentum moving in the right direction. As you get some of that behavioral momentum, that's going to affect some of your thoughts about yourself and the world. And then as we're slowly chipping away at the behaviors and the thoughts, that's going to have an impact on your mood. Again, is this a panacea? Is this a cure-all? No, but it will help you to move in the right direction. So my name's Lauren Linford. I'm a clinical psychologist. And if you're interested in learning more about this, I just started this account and I'm going to be talking more about stuff like this. If you're interested, give me a follow.